If I went for a run, I went for a jog, when I got back from that jog and got into my house, I noticed that my heart rate from the Apple Watch, it actually said irregular heartbeat, and my heart rate went into 185, 186 level. It shot down to like in the 80s. It shot back up to 170 and went back down to 90. You get the point, it was like all over the place. So I knew something was wrong, and I immediately asked my wife, who was here in the house with me, to drive me directly to Memorial Regional.
He came to the hospital, and he had a EKG showed that he had a heart attack. So he was rushed emergently to the cardiac catheterization laboratory, where we went ahead and did a procedure to fix his heart to make him feel better.
After a few minutes, they were able to confirm that I had something going on. I had 100% blockage in one of my arteries, and they actually paged a heart surgeon to come in to put a stent in. He got there, put it in, and I'm able to be alive here to talk to you and tell you my story today.
Yeah, so COVID, as we know from studies now, since we've been dealing with this for about a year now, is that it can cause dysfunction of the lining of the blood vessels called the endothelium, which can increase patients' risk of having blood clots in the heart. We're also seeing it in the brain causing strokes, or in the lungs causing blood clots in the lungs, pulmonary embolus. In his case, he had a blood clot develop in the heart, which caused him to have a heart attack. So I guess with COVID, we're seeing patients come in. Most people think it's just a pulmonary condition where they're coming in with trouble breathing, and some patients are fortunate that they're winding up on a ventilator to help them breathe. From a heart standpoint, we're seeing patients come in from chest pains induced from COVID all the way up to having heart attacks or blood clots in the heart, to having congestive heart failure or myocarditis, where you get inflammation of the heart muscle, all which can be potentially very serious and life-threatening.
People can look at me and say, not overweight. I can tell people that I don't have diabetes. I don't have any of these indicators that a lot of people would think that typically COVID is going to attack. The easiest advice that I can give people is that this isn't just on TV. This doesn't just happen to someone else. I was actually born in Memorial Regional Hospital, the same hospital that gave me care here. And then this is where I was able to turn to save my life 51 years later.